All right, we are live.
Okay, good morning. Thank you, Nellie. Today is April 9th. This is the Senate Health and Welfare Committee, and we're continuing our work during the COVID-19 emergency online. And welcome folks who are out there in the real world. Thank you for being with us. So this morning, we're continuing to take some testimony on substance use disorder. Our last set of testimony, we were unable to hear from Chad. Is it Chad Viger? Did I pronounce that correctly, Chad? Chad, are you there?
He looks muted.
Chad? Not there. Okay. Is Tom Dalton here?
I'm here.
Oh, terrific, Tom. Thank you. Thank you for being here. We'll begin with your testimony. We've been looking at the issue around substance use disorder during the emergency. What's happening out there with folks? What are the needs? What are the gaps? And what are the possible policy recommendations that can be made to help people through this emergency, especially those who, in this case, have a substance use disorder? Do you have anything for us in written testimony?
I haven't submitted anything. I could afterwards if you'd like.
That would be great. So why don't you go ahead and we'll hear your testimony, and then when you're finished, we'll go back to Chad, who I see is here. Okay.
Okay. So this is Tom Dalton. I'm the Executive Director of Vermonters for Criminal Justice Reform. And just by way of background of why somebody in that position would be interested in this topic, I'm an attorney and a licensed alcohol and drug counselor. And for over 20 years, I've worked on opioid use disorder, first at the Vermont Department of Health, and then 17 years at the Howard Center, where I started and managed the Safe Recovery Program. And so I've been very interested in about how COVID-19 is impacting people living with opioid use disorder, including those who are incarcerated. And I'd like to start by talking about the hub and spokes medication assisted treatment, or MAT system. And I think you guys heard testimony earlier this week about how under the current national health emergency, the federal government has relaxed federal guidelines relating to MAT take-home medications to reduce exposure to COVID-19. And the changes are designed and intended to reduce the risk of exposure for MAT patients and for staff and for the public. And under the new guidance, hubs can provide all stable patients with 28 days of take-home doses of the patient's medication for opioid use disorder, and the hubs can also provide 14 days of take-home medication for those patients who are less stable, but who the hub believes can safely handle take-home medication. And so the guidance says that clinical stability and the ability to safely manage medication has to be determined by the clinical team, and it has to be documented in the patient's record. And so I was listening earlier this week when the committee heard testimony from Bob Bick of the Howard Center about the hub in Burlington, but this really applies to the hubs across the state who continue to see large numbers of patients every day in person. So I think Bob said that the hub in Burlington continues to see about 200 patients a day in person. And hundreds of patients in Vermont, hub patients, are still required to risk exposure to COVID-19 by traveling to a hub daily or every other day, or frequently to get a medication that they rely on to survive. So they really don't have any choice. Many don't own cars and rely on shared rides or public transportation, or they're traveling on foot or by bicycle. And many have underlying health conditions that put them at increased risk for COVID-19 death. And this underlying health conditions, unfortunately, are more common in this population. And one example would be hepatitis C, which the CDC considers one of the risk factors, which is very, very common among this population. Many have children that they have to bring with them. And when they arrive, they are, from what I understand, not provided with gloves or masks. And the hub staff often are not wearing gloves or masks either. Dosing hours are limited. For example, at the Chittenden Clinic in Burlington, they're limited to morning hours. So the patients arrive, many of the patients arrive at the same time. And please interrupt if you have questions. That would be fine with me. I'd welcome that.
So,
But yes.
Tom, why don't you give your testimony? We'll look to end your testimony, in about 10 minutes or so, and then we'll open it up for questions. And I know that you
Okay.
will provide us with something in writing that we can post on our webpage, and that would be
Sure.
very helpful. The question about gloves and masks, I think, is an important one, and whether or not how the recommendations from the Department of Health are being followed. Wherever we go, we're hearing similar stories. So we'll follow up with that one. Thank you.
Okay.
Okay, good.
So I'm spending a lot of time these days talking to people living with opioid use disorder, or people who are incarcerated, and there's a lot of overlap between them and their families. And what I'm hearing is a lot of fear and a deep sense of helplessness at not having any way to control the systems that many people are feeling are putting them or their loved ones at unnecessary risk. And I think we have to find ways to further reduce the number of patients who are being forced to expose themselves and their loved ones to that increased risk of contracting COVID-19 in order to continue treatment for their other life-threatening condition, opioid use disorder. And so I think we have to do this for them and for the clinic staff and the public. And one suggestion that I would have is to require that patients be provided with masks and gloves prior to entering the hub. Seems like a kind of a baseline common sense thing to do. Although I know that in the real world, finding those masks and gloves is sometimes a challenge. Another suggestion, which is a little more complicated, is to create a presumption or an expectation that all hub patients would be given 28 days of take-home medication, and that hubs would be required to document in the medical record first a specific individualized factual basis for denying the maximum allowable take-homes under the federal guidelines. So that is to require documentation of a specific, not a theoretical, basis for determination that the patient is so clinically unstable or their ability to safely manage medication is so clinically compromised that they should be limited in the number of take-home doses below the 28-day baseline. And the second thing would be to require the hubs to take steps to actively address any clinical instability and enhance the ability to safely manage medication at home in an ongoing and timely manner, and document those efforts in the clinical record as well. So, we have tools available to try to make it more reasonable for people to manage their medication at home. That might be, instituting random callbacks where you ask people, instead of asking them to come every day or every other day, you ask them to come in at random times to show that they still have the right amount of medication in their lockbox, providing lockboxes, which I think the clinics are doing, random drug testing, and then also counselors can check in by phone and often can do virtual med checks by video conference. And then the other idea would be to designate a responsible person who could monitor the medication in the home. A lot of people would have access to somebody that might be able to help them manage their medication. And so the third recommendation would be requiring the hubs to reassess eligibility for increased take-homes at least weekly and update the clinical record. Because I think what we heard from Bob Bick earlier this week was that the hub in Burlington, they moved everybody up one level. So people that, had a particular number of take-homes were moved up to the next level of take-homes. But I think, we need to get to a place where we're making individual decisions about the maximum number that somebody might be able to responsibly handle, but also working to increase their capacity and address any instability or any concerns so that we can get a lot fewer people having to travel in person to the hubs.
So let me,
I also,
let me ask a question. So without getting into the micro piece of it, because, that's more difficult for us to do. And we actually rely on the experts at the Howard Center or some folks like you or at the hubs. What you're suggesting are some uniform standards to protect both the patient and the counselors or folks at the providers at the hubs. So you're looking for uniform standards that would adhere to the Department of Health or CDC standards that we've heard so much about, including extending the dosage over time. Okay.
And just to be, I guess, candid, what I'm looking to do is to flip the burden of proof in a sense. So in general, I think that, medical providers that provide medication-assisted treatment, they have, sorry.
Okay, take your time.
Sorry about that. They have, there's a long-standing fear about liability in a system that, has been designed to prioritize limiting diversion. And I think that generally a lot of providers feel that they have to justify giving people take homes. And so I think in the context of COVID-19, we need to give them the message and the support to say, the baseline, the default position needs to be that people don't have to leave the safety of their homes and travel through the community any more often than absolutely necessary.
Tom.
Yes.
I'm going to ask senators who are not muted to please mute themselves. We're getting some background.
Are you coming by?
Thank you. Okay, that works.
Okay.
We're listening.
So I think that part of the recommendation is to create an expectation that people be given the maximum number of take homes. And instead of asking providers to just document a justification for giving take homes, to ask them to document a justification for withholding take homes, because COVID-19 has kind of flipped that logic. And I think that the idea that we would be asking hundreds of people every day across Vermont to leave the safety of their homes and travel to hubs in the midst of a pandemic, should be shocking to us. But, it's I think, unnecessary in many of the cases. And I think that one of the reasons that we're still seeing so many people being required to go in person is a fear about diversion. But the idea that diversion risk should outweigh the risk of COVID-19 in an environment in which access to fentanyl is pretty ubiquitous, to me, doesn't make sense. And I also am very mindful of the fact that I believe that some of these policies reflect how we treat stigmatized populations differently. And I think it reflects longstanding fears about liability related to diversion. And so, you know, my many years of experience tell me that the number of people that should be going to a given hub, anything close to daily or every other day, should be less than 5. And one of the reasons that I think that is based on the experience of Safe Recovery's low barrier MAT program. And that program has enrolled many of the patients who were deemed too unstable to get services at the hub. So these are a lot of the clients that they're serving are people that have been banned from the hub and in effect deemed untreatable. But Safe Recovery has been able to successfully treat many of them through a low barrier program, and that low barrier program does not do any on-site dosing. And so, you know, I think that what I'm suggesting is that it would be helpful in this context for the legislature to give permission basically to the hubs to be much more aggressive about allowing people to have take homes and to ask them to document why they're denying them if they are, to revisit that decision frequently, and to be really actively working to allow the person to have take homes if they have a reason that they're denying them. So to actively address the reason for the denial and try to mitigate that and create the conditions where the person can get take homes.
Thank you. I mean, that's very clear. Can we ask questions at this point? Is this the time to do that?
Perfectly fine with me.
Okay. I guess the question is, do you have additional comments?
Oh, okay. I think on this topic, just also maybe asking the health department to implement some quality assurance measures to make sure that hub patients are not being denied access to take homes except as a last resort, and then only as briefly as possible.
Okay.
And then I also, that probably ends my suggestions around MAT, other than a brief suggestion around incarcerated people. And then I didn't know if you guys wanted to talk about the incarcerated population around COVID-19 separate from the MAT issue.
I think so, but I think what I would prefer to do, if you have time to stay on your call until after Chad has had an opportunity to testify, then we'll come back to DOC. It's not actually in our jurisdiction, but we do spend time working with judiciary on the issue. So it would be helpful to hear your comments, but let's see
Okay.
if there are questions about the MAT piece first, then we'll go to Chad, and then we'll circle back to Department of Corrections issues with MAT.
Okay.
So committee, questions? Okay, you made it sound very clear, and
Oh,
that's
good. I'm glad.
no, that's a good thing. That's a good thing. So I guess the issue around liability related to diversion is a huge one, and I know I've heard concerns about liability in other areas as we are in the medical emergency. You know, who gets triaged out of the emergency room with COVID-19, who gets the ventilator, some of those questions that we haven't actually had to address yet. And so this is not a trivial question about whether or not to treat someone long-term or not. So we'll have to, I know that our Ledge Counsel is on this call with us, Katie McClinn, and Katie will help us walk through that a little bit. We'll probably have to have some comments from other folks about your recommendations. So getting your testimony in writing would be very helpful.
Okay.
Thank you very much, Tom. And if you have time to stay on, then we can circle back to
I will.
that. Thank you. Okay.
Thank you. Thank you.
Chad, welcome. And are you here?
I am here.
Terrific. And could you please introduce yourself for the record and then present your testimony? Thank you. Do we have
Yes,
anything?
thank you, Senator Lance.
Do we have anything from you in writing as yet?
I sent it over to Nellie.
Okay, so we have it on our webpage. Yep, thank you.
Thank you, and thank you for bearing with any technical difficulties. I've been kind of struggling this morning on the tech side.
We know about those.
So my name is Chad Vijay. I am the interim CEO for Recovery House, Inc. I took this position about 3 weeks prior to the start of the pandemic here. So this is all new, and COVID-19 is certainly outside of my bailiwick as well as other people's. But prior to that, I did serve as the clinical director here for about 4 years in my second stay within this organization. So today I wanted to share with you how COVID-19 is impacting residential substance use treatment, as we are in somewhat of a unique position where we might be lumped in with nursing homes and long-term care facilities, yet we don't quite fit because of the population we serve. And the services that we provide are different. And we don't quite fit in the outpatient substance use side as well. So we have come in contact with some unique set of challenges, and I wanted to walk through those challenges with you. And a lot of them are similar to the long-term care facilities, as well as needs that we're working on and we need some assistance in working on as well. So I think the biggest challenge that we're facing is a reduction in census. We are adopting COVID policies that require us to designate a certain area to isolate individuals, and that can only be done if we are working with fewer people.
You're fading out, Chad.
That, no.
We can't hear you.
Can you hear me now? Let me see.
Try again.
Can you hear me now?
Yes.
Okay.
Yes.
So we're operating at a reduced census due to COVID-19 protocols that we've had to adopt. And we're also operating at a reduced census based on us having to discontinue detoxification services for alcohol, for benzodiazepines, and for opiates. And part of the reason for that has been our struggle with staff retention during this time.
Mhm.
We have had several nurses that are no longer able to work with us related to COVID-19, whether that's fear or being called up to work more hours at the hospital. So it is extremely unfortunate that we cannot provide that service right now, but we are taking steps to bring in more nursing and retaining the folks that we do have. So staffing and spacing has required us to reduce our census. Staff
gone.
retention remains a huge challenge, not only with.
You're back. You're gone. You're going in and
I'm
out.
back. How about now?
Now.
Now?
Yeah.
All right. So staff retention, even outside of nursing, has been difficult. We recently introduced a hazard pay for all staff, which is providing them an extra $5 an hour to stay on. We see that as really critical to keeping staff in the building and having them willing to work with patients who may be positive for COVID-19. Since it is out of our wheelhouse, our staff have a pretty heightened sense of fear around this. So we're working with them in terms of providing this hazard pay and also talking to staff daily to try to reduce these fears by processing the situation as it unfolds. We also are reaching or seeing a challenge in protection equipment. I imagine everyone has seen similar challenge. We carried minimal amount of supplies beforehand, considering our limitations as it relates to medical. And so we have been kind of scrambling since the beginning of March to try to create some sort of supply for PPE. Unfortunately, it's not where we want it to be and need it to be. So we're trying to get creative with administrative controls as well as engineering controls, kind of limiting staff contact and creating certain barriers if we do presume someone to be positive with COVID-19. So those are the series of challenges that are kind of immediate with us. And what we're doing to try to tackle those challenges is we're trying to overstaff. We're overstaffing at a time when we're seeing reduction in revenue, pretty significant reduction. We're bringing on traveling nurses, which is not necessarily financially sustainable, but that would allow us some time to recruit nursing the traditional way. We are looking to increase our support staff, knowing that we might lose folks to the fear and we might lose folks to becoming sick. So we do need additional staffing resources, and we are working and actively recruiting staff each day. And then of course the financial side of things as well. We're trying to see and go down certain avenues related to payroll protection loans, Medicaid retainer options. I'm not quite sure the extent of where the financial impact will be, but we're trying to unearth every option for us and our employees. And we want to stay open. That is our goal. It's unfortunate that we can't deliver detox at this time. We do want to get that back online as quickly as possible, but we are working with a population that is already struggling with a deadly disease. We just now have another deadly infectious disease on top of this one that we have to navigate through as well.
Chad.
I certainly appreciate, yes.
Thank you. This is helpful. I think it resonates with what other folks have shared with us. I do have one question. We've heard quite a bit about the use of IT, telephonic communications, electronic communications. Are you able to do any of that work with your clients, even those who may have you've lost, currently lost?
So right now within our agency, we only have 2 people working remotely, and
Okay.
the rest of our staff needs to be in the building, as there are milieu management issues that come up every day.
Mhm.
But to reduce foot traffic on a daily basis, we are having some staff members work every other day and rotating through there. And those staff members, if something needs to be done that day, they are able to Zoom in. But I think we're operating at a point where we can't send any more staff home because of the client needs that are still remaining.
Okay. Thank you very much.
Thank you.
I think it would be very helpful if we could get your testimony in writing, including a description of your facility and the work that you do. That would be
Yes.
helpful, I think.
Absolutely.
All right. Questions, committee? Okay, Chad, thank you very much. Let's circle back to Tom. We don't want to spend more than 5 or 7 minutes on this one, Tom, but
Sure.
maybe your update on Department of Corrections and thoughts that you have.
Okay.
MAT
So
thoughts.
just to talk about the MAT and correctional facilities, I'm continuing to hear from people that they're being required to sit, quote unquote, elbow to elbow in a row with other patients to be dosed with their MAT medications. And they, they're not wearing masks. They have to, put the medication in their mouth and let it dissolve. And so one suggestion would be, and I think this may actually have changed yesterday, but I'm not sure that it's a permanent change because of the, I think that most of the facilities are now on lockdown or modified lockdown. So people may be getting their doses in their individual cells, which would be the recommendation, and something that's done with other medications or has been done in the past. I asked somebody yesterday who I know gets MAT in the correctional facility, and they hadn't been dosed yet under the modified lockdown, and so they were going to report back to me. But they said their expectation was that they would be asked to come out into the common area of the unit. That the modified lockdown meant that they weren't supposed to leave their unit, but they could leave their individual cell, and that they anticipated they would be asked to come into the common area and be dosed together. So, I think that in terms of social distancing, we should be giving people their medication, separately, if at all possible.
Okay.
So that's the end of my MAT related comments. I have some other things that I could say about COVID-19 in the correction setting that's unrelated to substance use, if you want me to.
Well, why don't we hold that thought? Because
Okay.
I think that may well come up as we work more with judiciary.
Okay.
But if you would, please add those comments in to whatever testimony you submit to us. Then
Okay.
that'll
Sure.
help us determine what direction to go.
Okay.
Does anyone have a question for Tom or concerns about his comments on COVID-19 separate from MAT? Okay, we're good.
I really appreciate you having me. Thank you.
Well, we appreciate your being here. What we're learning is critically important to whatever we might do to help folks maintain distance while getting the medications that they need and getting through this terrible time. We know how stressful it is.
Yeah, and I think I would like to take a minute to say as well that, I'm making suggestions that I hope are constructive about improvements, but I'm really wowed and pretty overwhelmed by what an amazing job that, the Department of Health, the Department of Corrections, and hubs like the Howard Center have done. It's pretty amazing and impressive, and I hope that nothing I said is taken as minimizing, the work that they've been doing, because I do have a lot of admiration for it. And, but I am spending a lot of time hearing from individuals and families, and I feel like, if there are ways that we can continue to improve, it's important to look at those.
Thank you for that comment, because I think we all are in complete agreement that the work that's being done by the administration, the DOC and others, the work that's being done by the Howard Center and others is just, it's amazing work. We're in unknown territory. And as we go along, we find that there are new suggestions. Those are not they're not critical or judgmental, but I think what we've heard them is in the spirit of cooperation and trying to just to help. So,
I hope so.
Yeah, no, thank you for that. I think
Okay.
we get it. We understand.
Okay. Thank you.
Yeah, good. All right. We're going to move on. I'm looking to see if Melissa is on yet. I see that Steve is here. Steve, were you and Melissa going to, were you in tandem for this? Steve, are you there?
Hi, good morning.
Oh,
Yes,
there you are.
Hi.
Are you going to work with Melissa on the testimony? Because I know you're both here.
yes, that's correct.
Okay, here's what my suggestion is, committee. I'd like to take a 5-minute break, please. And we're going to come back. We've all been on a meeting since before 8:30 this morning, and we would like to just take a 7-minute break. 8-minute break. We'll return at 10:25. And thank you all for your patience. I know that most of you who are coming up next are scheduled at 10:30, so this shouldn't be too much of an inconvenience. So we are on break until 10:25. Thank you
you.
all. Okay, so I'm going off video and off audio, and we'll be back in 7.
Ginny, can you hear me?
Yes, I can.
Okay, I got you.
Okay. We'll start as soon as we get a couple more senators.
Oh, you and I could run the whole committee, Ginny.
We could do the whole thing.
We could do.
There you go. With Debbie. We need our clerk. If, I hope that background for Floyd Neese is not real.
It's wishful thinking.
Okay, okay.
Okay,
All
I'm
right.
back, and if I start coughing, it's because I just swallowed something the wrong way.
Well, take your time, Senator, and put yourself on mute, and then we won't hear you.
Then you won't hear me.
But
Okay.
we'll save you if need be.
So I'm breathing.
That's
I
good.
just have a very good cough reflex,
Okay, I know.
a sensitive one. Okay.
All right, so we are back. Senate Health and Welfare, April 9th. Thank you for bearing with us while we took a short break. And we have Deputy Commissioner Berbecco, and we have Program Director Melissa was here. Are you here? Is she here?
I am here. Yes.
Rigel, how do you say your last name? I'm sorry.
Regal Garrett.
Regal Garrett, thank you.
There
There you are, you're right next to me, okay. So are the two of you going to, do you have prepared testimony to give together? So why don't we, our goal is to understand a little bit about what is going on with childcare and what are the next steps that may or may not need to be taken. Before we begin, I want to ask Senator Westman if he has any comments to make. He helped to put this all together. Senator Westman.
Well, thank you, Chairman Lyons. Senator Hardy and myself, at the urging of the President Pro Tem, have been tracking this, and Melissa and Stephen have been really helpful, and I think they have a good story to tell. A few bumps, but it's a pretty good story.
Well, we'll look forward to hearing it then. Thank you. And Senator Westman, thank you. And Senator Hardy is not here with us, but she has done an amazing amount of work on this issue, and we should say thank you to her. I don't know whether she's listening today or not, but we will extend our thanks to her for her work. So is it all right to call you Melissa and Steve? Okay, thank you. Why don't we turn it over to you and you provide us with the update on the work that's going on with childcare, please.
Good morning, Chair. Good morning, Senators. For the record, my name is Stephen Berbecco. Also with us today are Melissa Regal Garrett, CDD's Policy Director, and Sarah Truckle, DCF's Finance Director. And I have to let you know, this is the first time that I'm giving testimony in Vermont, and I hadn't pictured that I would be doing it wearing slippers. It is a very unusual time in so many different ways. And it's also a very unusual time for us in CDD, in the Child Development Division. We are making changes rapidly to adapt to this new environment in Vermont, and looking to the Governor's Office and Department of Health for our starting points when we develop our revised guidance. We are grateful to the Vermont community for helping us manage these changes to policies and implementation, and especially recognize the efforts of staff, Let's Grow Kids, and community partners who all come together to recognize that childcare is a critical resource for the state of Vermont. The Child Development Division is supporting the state's priority for the safety and health of Vermonters. We're doing this through the infrastructure of regulated childcare programs that are open for essential persons. The referral process that matches essential persons with open childcare programs is a cooperative effort between the Child Development Division, Let's Grow Kids, the Agency of Education, and community service agencies throughout the state. At present, there are 388 programs that are open and serving children of essential persons, roughly a third of the total program pre-closure. And I should add, with these numbers and most of the numbers you'll hear this morning, that they are subject to change day to day. Of those 388 programs, there are 263 that are registered childcare homes. That's about half of the registered homes pre-closure, and 125 licensed centers, and that's about 17% of our number of pre-closure licensed programs, program centers. The total, ma'am?
Just a quick question. I don't see that there's any testimony from you on our webpage, and given that you're giving us some numbers that might be helpful, if we could get at least an outline of the testimony that you have. I know I don't want it to be extra work, but the more we have, the better we can help.
Well, thank you for that request, and we're certainly glad to provide
Good.
that information.
Thank you. That would be great. Okay.
I wanted to add that the total number of children of essential persons as of this morning, we believe is approximately 1,892. Again, these numbers are subject to change and subject to further verification. Our total number of slots across the state are a little more than 2,000. And we are still seeing some pockets within the state where we're having more challenges matching and referring families with open and available childcare. The good news is that we have seen our requests for referrals plateau recently, which indicates, or at least suggests, that the essential persons in Vermont have by and large found the childcare needs for their families. We're supporting the continuity of the infrastructure of childcare programs in Vermont through financial stabilization programs. And I'd like to ask Melissa to pick up on a description of those programs.
Absolutely. I would love to start just by saying that we are serving essential workers, children, in the context of the governor's Stay Home, Stay Safe order. And to that end, just like any other Vermonter, it is expected that if essential persons are working inside their home, or they have another person that is working in their home, that the children would be home with those folks in the same context, as I said, as many of us with our young children floating about as we do our work. In addition to that, we, as Deputy Rebecca talked about, we are working very closely with the Vermont Department of Health. The Vermont Department of Health has issued guidance. We just updated that this week. Dr. Brina Holmes provided a webinar for our childcare programs that are open. And some of the things that are in that guidance are checking temperatures of children before they enter the building, not having sick kids present or being provided care for, the use of masks and gloves, and really, a heavy emphasis on sanitizing and hand washing. Certainly trying to do this work as much as possible, keeping everyone that is engaging in this as healthy and safe as possible. I'd also like to say that all of this system is voluntary. So the programs that are providing this care have stepped up in a voluntary way. The staff that are doing this work day to day, again, are doing this, not that they aren't being paid, but they are not required to provide this care. And families, of course, this is an option for them. They're not required to use this system. So, just keeping in mind, as much as grocery store workers and hospital workers are essential to this response, so are our childcare providers. And that's the context in which we are offering this service during this time. Our work on behalf of essential providers, as Deputy Brebeco mentioned, does include referral services. It also includes capacity building, and there are different areas in which we are focusing that effort. It is on health and safety in conjunction with the Vermont Department of Health. And finally, there are financial supports available for the programs and the families that are needing to access childcare during the COVID-19 response. What that includes is for infants through preschool age children, we do have tuition payments that are being made on their behalf. For folks that are accessing alternative childcare programs, their childcare program is closed, we will pay full tuition up to $360 a week on behalf of that family. In addition, for school-age children, we are offering $200 a week in tuition to help offset the cost of tuition for those children during this response. And then on top of those tuition payments, we also have incentive payments of $125 per week per child for all children served in our regulated system, infants through grade 8. So those are the financial supports that we are providing through the service of childcare for essential persons. Senator Lyons, would you like me to pause there and take questions on that program before I talk about our financial support for stabilizing the closed regulated childcare system, or would you like me to continue? I think you're muted.
I was muted. Thank you.
Yeah.
I think unless a committee has specific questions at this point, why don't we go ahead with your discussion on stabilization funds? And then again, it would be extremely helpful if we could get your testimony in writing. I know that a lot is going on. I know that there's that in the past, folks with kids at care facilities had to pay 100% whether or not their kids were in the facilities, and now that's been reduced to 50%. And so having some of the details on this would be helpful. And then as well, when we passed H742, we took the cap off of the CCFAP. So how that is affecting a change, that would also be very helpful. So we'll listen to the rest of your testimony and then move from there. Maybe we'll ask questions after that.
Sounds great. Awesome.
Thank you. Okay.
You teed me up perfectly. Those are exactly the things I'm going to talk about.
I was hoping.
All right. So in terms of stabilizing the closed regulated system, the first lever that we were really able to pull was in regards to the Child Care Financial Assistance Program, the subsidy program, beginning back on March 18th and continuing in an ongoing way. In terms of children, we shifted from an attendance-based payment system to an enrollment-based payment system. And what that means is that essentially our system will continue to pay for all kids that were enrolled prior to this crisis and continue to be enrolled in their childcare program through the crisis. So that system is not changed, and we just are moving right along with that. And then we took a look at stabilizing in terms of the private pay families and the tuition payments that are made by private pay families to childcare programs. Really thinking along the lines of wanting these spaces to be available to families as at the other end of this crisis, to have a childcare system where people are able to return to work and have a childcare system that is there and available to them. So it did roll out in 2 parts, as you indicated. Part 1 ended on April 4th. Under that one, we paid full tuition payments for families that weren't able to pay for their childcare slots. So we did ask families to cover their regular tuition, to work with us for those that were able to do so. It was a big help. But for those that were unable to pay their tuition, we were covering that cost at 100% through the first 2 weeks of this response period. We asked programs to pay all their staff at their full regular salary and to maintain the slots for those enrolled families, regardless of whether the family made any payment or if we paid 100% of it. So that was part 1. At the beginning of this week, we shifted to part 2 of this. This is really because, we became aware that this was going to go on, the closure of this system for an extended period of time. And frankly, there were some financial considerations to take into account to be able to figure out what could we do as the state of Vermont on a sustained basis in support of this system. Again, with the real idea around preserving spaces so that childcare is available when everyone returns to work. In part 2, the state's able to cover 50% of tuition on behalf of families. And if families don't pay 50% or perhaps a lesser agreed to amount of tuition between them and their provider, then the state will move to picking up 100% of that if the family is unenrolled from the child care program. And so again, requirements with that is that they continue to pay all their staff at their full salary, and for families that are paying up to 50% of their tuition, that those slots continue to be maintained for that family at the other side of this crisis. So that's essentially where we've come in terms of part 1 and part 2 of the stabilization program for private tuition families.
Okay, thank you. Thank you for that. That was very clear. Appreciate it. I think the committee will have some questions. As one of our goals, obviously, is to look at what is coming in the federal CARES COVID-3 and what, if any, funds are available for essential workers or for childcare generally. And I don't know which one of you, perhaps Sarah or Steve or Melissa, you have some information about what is there for Vermont in the federal package.
Yes, so we do know that through the CCDF dollars, that's the funds that typically cover our child care financial assistance program, that we're going to see approximately 4.3 million from the federal government through the CARES package or the COVID-3 package. And we have worked closely with our federal partners. We understand that our essential persons can be a category of eligibility. It does not require them needing to apply for that, but we can use the state's definition of essential persons, and folks that meet that definition, we can cover, we can use the 4.3 million to cover the cost of that program. Further, we are looking into, we're fairly unique in our stabilization program. And so we are looking into what it would take for us to be able to use also funds from that 4.3 million on that stabilization program for the system on behalf of the private pay families. And we are thinking it will take some sort of a waiver, but I have a call later today to figure out exactly what that will look like. So far, the feds have been extremely cooperative. They've been in problem-solving mode with us. So when we've asked them around uses of these dollars, it really has been they're acting on our behalf to do as much problem-solving as possible to make it easy for us to apply these funds. So I am not at this point anticipating any issue with that. but that's what I know of. And Sarah Truckle, she is the Director of Finance for the Department of Children and Families. I know you're on. Would you want to weigh in on anything having to do with that?
No, I think you've covered it. So we do expect the $4.3 million in the increase of CCDF, and we do hope to leverage those dollars and plan to for this particular program. We're also exploring other funding sources as well, and continuing to track the cost of both the payments made on behalf of essential persons, as well as payments made as part of the stabilization program.
I guess the big question for you is how you're costing that out forward, how you're corralling all that data and information to know exactly what will be required for stabilization. It's certainly it may well be more than the $4.3 million, but then how you're going to put that forward, and how you're going to help as many folks as you can. I don't envy the job that you're doing, but
Absolutely. So we did some preliminary fiscal analysis on the program itself, figuring out the cost per week based on some estimates of the number of childcare slots within the state of Vermont, as well as average tuition paid by families informed by our market rate surveys and our CCFAP rates. So we're aware of what the cost is, what we think the cost is per week. And now it's really getting the data and having the payments roll out to be able to look at our estimates and move forward. And also being informed with potential other fund sources as they come about, which I think is changing day to day. And I know we're all having those conversations.
thank you. It will be great to stay in touch as you make some decisions, because we're going to hear from constituents, you know that. And so we need to know how decisions are being made, what the criteria are that you're utilizing, and then what else is needed to help this move forward. So thank you.
You're welcome.
Committee questions for Senator Ingram. You're muted. You're not.
Thank you. Yeah, I just want to make sure that I completely understood about the 4.3 million. So I think I understood Melissa to say that that will definitely apply to essential persons. And then I guess maybe the hope is that there will be money left over, though, that could be applied to stabilizing for other families if the federal government gives us a waiver to do so.
That's correct. It really depends on the length of the closure of the childcare system. We know the weekly costs, and depending on the length of the system, we may need the 4.3 to fund that essential persons piece of it. But you know, if we're lucky enough to come out of this sooner rather than later, then we could certainly we don't want to leave any federal money on the table. So we are definitely trying to figure out, you know, where can that actually be applied.
Okay, all right, thank you.
Senator McCormick.
Thanks. How does the present child care differ from what we had before we shut down the existing child care, the pre-epidemic child care?
Pre-epidemic.
How is it safer specifically? Why didn't we just leave the child care facilities open in the first place, and maybe take steps to make them safer?
Mm-hmm. I think what we've done most dramatically is reduced group sizes. So at the recommendation of the CDC, the maximum group size is 10. That includes adults and children. And so for most of our programs that are operating, that's a pretty drastic reduction, especially at the preschool and school age level. And so with that, you know, we really needed to make sure that the spaces that were open for essential persons and not for the general public per se.
So is that using pre-existing childcare and just reducing the population in them?
That is correct. Essentially, the order closed the childcare system as we knew it. And folks that were willing to quote unquote reopen for essential persons did that. Some programs are only serving the essential persons that they had enrolled in their program prior to this crisis. Other programs have been willing to take additional families whose program did not remain open, or at this point now, the families of school agers where they are essential workers and those kids otherwise would have been in school for the full day.
I expect that my colleagues are experiencing the same thing I am, which is that rather than there not being enough information, there's so much information that people can't wade through it all. And increasingly, we're getting angry communications from our constituents about the terrible, ridiculous things the state is doing, which they heard about, on the internet or something. And one of the stories I get from constituents is that we shut down all the daycare centers, we shut down all the childcare, and then set up new ones. And that it was it was wasteful and really didn't accomplish anything except hurting the finances of the existing childcare. So you can answer that. That's not true.
That's not, well, it's not true. We did shut down the system, but the programs that are open right now are our regulated programs that were regulated prior to COVID-19. So these aren't new programs that are open and running.
Well, Senator, I think we're going to hear from other folks who can, where did you go? Oh, who can respond to your question.
Yeah, just one more, which is where, if we're reducing the population to 10, including adults at each facility, then you got a lot of kids left over. Where do they go?
Right. So it's not to 10 at each facility, it's to 10 per group, and those groups need to be kept completely separate from each other. So they aren't able to share spaces, including playground spaces at the same time. And so we do have centers that are operating with more than 10 kids in the building itself, but within each isolated and segregated classroom, they're only in groups of sizes of 10. And frankly, the capacity has been a bit of a juggle. We haven't been able to really utilize our online data system. It doesn't have the flexibility needed for us to do that. So we really are operating, thanks to Let's Grow Kids, on a separate database for essential persons looking for care to complete that tool and let us know they need care. And then we are literally Excel spreadsheeting information about which programs are open, how many kids they're serving, whether they're willing to serve and still have room to serve additional families. And all of that information is given to our referral specialists in in agencies in each AHS district. And those folks, this is their job in general, connecting families with childcare. And so they've been working, really hard and really focused with these essential persons to make sure they have care. We do have gaps in some areas. One in particular is the Addison County area, where we know there really isn't enough, and we are working hard to address that again as much as we can through the regulated system that already existed, whether that's using those spaces or those staff members. And our licensors are using a mechanism of a variance to be able to, as much as possible, see that we are able to increase capacity as needed and serve these children.
I think we have a lot of high school kids looking for something to do. If they have enough adult supervision, they might be good assistants.
I know, it's interesting. We've talked about the use of volunteers as well. However, it's another person that counts in that ratio of 10. So that's one less kid that we can serve. And we aren't able in our system to pay folks that are under the age of 18. We do require folks that are part of our counted ratio be at least 18 years of age. So there may be some high school seniors that meet that requirement of 18 years and older, and that's potentially a possibility. But as much as possible, we're using the existing staff within the system.
Thank you. Thank you, Madam Chair.
Yeah, thank you. One last question, Senator Westman.
So it's basically a comment and then it leading into having Melissa. The comment is that given the questions that Senator McCormick just asked, going from head count to enrollment that we've just done is a huge shift within the system. And in these childcare facilities where a lot of the parents have lost their employment, they were going to pull their kids out of the childcare facility. So you wouldn't have a whole facility anyways. But by using headcount, they're still getting paid. So we're going to keep them alive. So if Melissa, you could just make that a little, you made it clear before, but I think it would be good to just repeat what that means. And your thinking around why you did it originally.
I guess I'm a little confused in terms of what you want me to actually emphasize. Oh, and I have a helper.
You have a great helper.
Helpers are important.
Yeah,
So why did you move to enrollment?
So for the Child Care Financial Assistance Program, we moved to the enrollment basis rather than attendance, so that we actually could continue to pay. If families were going to be out and not attending, there's a cap of 15 days a year they can have in terms of a lack of attendance, and then we would stop paying the Child Care Financial Assistance on their behalf. So by going to enrollment, it essentially means that all of the subsidy dollars that we had spent pre-COVID-19, we're essentially spending the same payroll week to week on that system, and programs are continuing to receive that income.
Thank you.
Thank you. I think we probably should move along. Thank you to your assistant as well, Melissa.
Yeah, sorry about that.
Very capable. No, I think it's great. And thank you, Steve and Sarah. I'm sure we'll have more questions as we go along, but this has been very helpful underpinning for us as we look at childcare across the state. And we're going to move on now to, I think, Allie Richards, you're up next. So why don't you introduce yourself? And I think we have testimony from you on our webpage, so we'll go to that. Thank you for being here.
Wonderful. Thank you so much. And for the record, I'm Allie Richards, CEO of Let's Grow Kids. And what I think I'll do is just fill the gap of the conversation from the private side, which is what we've been doing at Let's Grow Kids. We found ourselves in a very unique position to be on the ground with wonderful partnerships with the state and federal partners, as well as the field, parents, providers, early educators, and employers as well. And that's what we just, without even thinking, pivoted completely our whole operation to be part of this response. As so many are saying, it's been gratifying. It's wonderful to see this side of humanity in such a dark and uncertain time, I have to say. And the state is working incredibly hard on all these details. Your questions are all well-founded, but these are programs that would have taken months and years to lift up in some cases, and everyone's getting them done in days and weeks. Let me first lay out quickly what we're doing at Let's Grow Kids, just to give you a sense of what it looks like on the ground, and it might help you all if you have further, questions or almost directives for us that you might suggest that we do, just to get a sense of what we're able to provide here. And then I'll just give a couple high-level remarks. So we found, as I think Senator McCormick said, too much information. There's so much information. And so one of the key roles we've been playing is digesting the federal, law, the sort of state guidance and all of these, pieces, family supports, and just sort of doing a daily guidance load and refresh on our website. So if you're curious about any of that, it is in my testimony, and it's at letsgrowkids.org/coronavirus. And we've been, we'll continue to be doing that. It's a key service we're playing. But then I would break down most of the rest of our work into two categories. One is emergency childcare for essential employees. So if you step back for a second, as your conversation has already been showing, what's going on with childcare in the pandemic? One, it's a huge, huge part of our essential worker response. So childcare has become, part of the front lines. And how do we do that right? And how do we do that well for both the, the industry and the early educators, and for those families, and, for parents? And then second, what is the overall guidance to this childcare industry to make sure we have a childcare industry in Vermont? And I really want to, I'm not trying to be an alarmist. I'm trying to make this point, which is absolutely real. We all know, you all know so well from the work you've done over the years, this is a fragile industry, right? Don't think any of us would have set up such an important thing like this if we had our druthers. And so nationally, they've been doing a lot of work surveying states, and about half of our childcare businesses across this country, will be bankrupt in 2 weeks. And so that's really sombering, especially at the same moment this pandemic is showing us, is giving us a front row seat to what you all have already known and been working towards, which is childcare is not a nice to have. It's an essential backbone of our economy. And right now it's essential for our essential employees. So, that's an interesting dynamic that's coming to bear. So we're really working in both of these spaces. First, we're supporting the state on this essential worker piece. And, to your point, Senator McCormick, honestly, what Vermont has done is best practice in the state. And right now, people on both of these two areas, people are clamoring for guidance from Vermont on what did you do? How did you do it? Give us the playbook. It's really, honestly, a wonderful part of this that I want to make sure you all really know and appreciate and sort of reflect your role in it. I just got a blog post from ION Early Education, a national group, and they're based out of Massachusetts, and it's called Vermont Leads the Way in the Face of Coronavirus. And it's an explanation of the programs that you just heard from Melissa and Deputy Rebecca. And it's basically saying, please look at what Vermont's doing and follow suit. So I just want to put that out there, because what the first thing that they did was say, we're not going to ignore the childcare industry. They are just as important as all these other folks. So the guidance to close down and reopen for essential employees was the first step in best practice response. Other states who haven't done it are seeing the childcare industry floundering. They're in the position to make their own decisions on an individual basis on, shall they stay open? Shall they collect UI? Shall they support their families, their essential families, all families, making these terrible decisions about public health? And so Vermont has sort of laid out the way and the path for these programs in a really healthy way. So part of what we've been able to do then is just, working with BBF and the state Help Me Grow, gather all the essential workers information. Who are you? What's your childcare needs? Deputy Commissioner Rebecca spoke to that. The second thing is, we have to ensure that the folks that are stepping up to do this are safe and doing it safely. That's coming from the guidance Melissa was talking about. We're working hand in glove with the Department of Health. We're doing hosted webinars to give childcare the best up-to-date guidance on health, so that they can, have access to these nurses, so they have the equipment, so they know what they should be doing to do this safely. At the same time, we're also now basically collecting supplies and disseminating supplies directly to emergency childcare, because they're out of toilet paper just like the rest of us. They're out of cleaning supplies, and they're providing emergency childcare. So we are literally working with I got to tell you guys, Vermonters are amazing. This. We're seeing it firsthand every day. Foley Distribution down south, in Rutland, they are literally breaking up pallets, repackaging them, and getting supplies. They're the only people with product left. In many cases, they're getting supplies to emergency childcare so they can do this important work right now. And Twincraft, another example, 7th Gen, they're literally, collecting and distributing, donating supplies and products that are very hard to come by. A quick note on this, one thing that would be nice to continue, especially as now the guidance says masks and gloves to be used in childcare programs, which is new guidance. We really need to get childcare folks into the supply chain for these through emergency ops and other things down the road, should we sort of find ourselves in dire need. So just a little bug in your ear about that piece of it. And then the last thing we're doing on emergency childcare is beyond the system, and you started to allude to it, all of you, a little bit, of reopening in the sort of more traditional childcare programs and settings. Some folks just need in-home care in a more informal way, right? So hiring someone into their house on more one-on-one setting. And that's something that we're starting to do. And we're starting with UVM medical students. They're already fingerprinted, they're background checked, they've got CPR, first aid, they want to help. And so we're just creating with Help Me Grow, which is the 211 Extension 6 call center, and these various networks. To your point, there's some teenagers that want to get involved. Wonderful. We're basically creating just the system of input in, input out to make it easier for families to get matched up with informal care options if that's what they need, especially in areas, as Melissa said, that we do have some regional gaps for childcare. So that's the emergency childcare side. Just to give you a sense of how it's a public-private partnership and everyone's kind of pitching in. We also have set up emergency loans for early educators in partnership with the VSECU, because in some cases they're navigating the system and they're low, income workers, and they're really struggling for a variety of reasons. And we also have an emergency childcare fund that we've popped up. We're working with the Vermont Community Foundation on their broader philanthropic response. Vermonters are saying, how can we help? And so we've channeled some of that into an emergency fund for childcare, because we know there will be some gaps. But let me pivot to the final piece of this, which is there are so many fewer gaps than there otherwise would have been because of what the state's doing for the child stabilization program. So the other piece that we're all working on here is, what do we do about childcare industry writ large? We need it to exist. Frankly, without this program, there would have been a good, case to be made that we would have lost our childcare. So I want to read a quote from my testimony, actually, from a provider right now who we heard from, who said, "I feel incredibly valued, and I so appreciate living in the only state that is helping providers by covering their lost income due to the mandated COVID closure. We will have a stable childcare system when we return from this mess. It will help folks get back to that work so much faster." But I have to say, that's a testament to the state, to the groundwork that you all have done, understanding the importance of this industry, and sort of this movement of people in Vermont that get this. Again, it's a tool in the toolbox. Let me say that. Not perfect. We understand there's hardship. Some families can't pay 50%. It's a hardship because it's complicated. There's a lot of different things to navigate. But on balance, Vermont's the only state doing this. And what we've said is we've committed ourselves to making sure we have childcare. And the stabilization program is a very clean and comprehensive way to hold the industry harmless financially. And think about it, without the security of knowing they're not going to go bankrupt, they couldn't possibly turn their attention to do the care for essential workers. So it's a key part of that response as well. And so, high level, there are so many tools now for childcare, thanks to this great response. So the state stabilization program, and for those who just say, you know what, my parents can't pay 50%. I know that, I'm hearing from them. They can close and go on unemployment. It's a different way, but it's another tool in their toolbox. And so what we've done at Let's Grow Kids is start a weekly webinar and get pro bono, sort of free access to HR professionals, to early childhood folks, to help them navigate which is the right way for them and their parents to go. Is it the stabilization program, a wonderful tool, or is it unemployment, paid family leave, a mixture of those things? And so we've linked up HR folks with them to do that work. So in closing, I'll just say thank you all so much. I think it's really important to note that we're following best practice, and we're following what we've all said over many years we wanted to do. The Blue Ribbon Commission, for example, expanding CCFAP, being creative with these funds and this program. And there's a couple, there's fault lines in the system that we're seeing right now, in stark view. One broadly is the folks who don't have health insurance, who make poverty wages, like childcare educators, are the ones that are being asked to serve right now, are the ones that find themselves in the trickiest positions. Thanks to a lot of these programs that the state has put forward, they're in a much, much better spot, but still it's a truth that I think we need to face. And one minor example is the IT system that you all started the investment for. If we had finished that IT system work and modernized our IT system, our recovery would have been a lot more efficient, frankly. And it's a great example of when we pivot one day soon, I hope, from response to recovery, we can all really start thinking about how are we showing our continued investment in the importance of this essential part of our economy and childcare. The IT system is a foundation for that. It's one-time funding. possibly it could be sort of one-time stimulus funding, down the road here would be a huge step forward, and other creative ways that we can think about to really make sure we flip the switch back on when the dust settles, and then we think about how to make this a lot more stable into the future. I appreciate the time. Thank you.
Thank you. It's nice to hear your enthusiasm and optimism in a time where we're not hearing that. We agree with you. Thank you. Thanks, Ally. Let's move on. Unless there are questions for Ally at this point, I'd like to move on to Morgan Crossman. Morgan, thank you for being here, representing Building Bright Futures. And so do we have something from you on our webpage?
No, I can absolutely send the written testimony as well.
Terrific. That's very helpful for us. So why don't you introduce yourself for the record, and then we'll listen to what you have to say.
Perfect. Thank you. So for the record, this is Morgan Crossman. I'm the executive director at Building Bright Futures. And I am also the mom of a 2.5-year-old daughter who is enrolled in childcare and also now in pre-K for the fall. So thank you for having me this morning. I do want to take just a quick moment to orient the committee to the work of Building Bright Futures and how we have transitioned during this COVID emergency. I also want to quickly note that I may also have a little helper in a couple of minutes and need to turn off my video. But
we're always good with that. We're good with
that. So, Building Bright Futures serves as Vermont's foundational early childhood public-private partnership charged under Act 104 to serve as the State Advisory Council on Early Childhood. So that is the mechanism that we use to advise the governor and the legislature on the current status of children aged birth to 8 and their families. And it's such a key role in this time, especially in serving as a neutral convener. So our mission is to improve the well-being of children and families in Vermont by using evidence to inform policy and bringing voices together across sectors and within regions to discuss critical challenges. I also apologize because I may need.
Whoop. We totally lost you, Morgan. All right. I think what we'll do is slowly move to Floyd Neese. Floyd, and we'll come back to Morgan. Hopefully she'll be back with us. So Floyd, welcome. And why don't you introduce yourself for the record and your organization, and then we'll listen to your testimony. And I think, do we have something from you, I think, on our webpage?
Yes, you do.
Thank you. Okay, we're good.
Okay, for the record, my name is Floyd Neese. I'm the executive director of the Lamoille Family Center in Morrisville. And you have my written testimony, and I'm not gonna burden you with having to hear it all, and I feel like a bit of a wet blanket. But in the Parent-Child Center Network, there are many of us who have childcare. Some of us are providing childcare for essential workers. Some of us chose to close our childcare. Those of us at the Family Center, we have an 8-child infant and toddler program. We had one infant who was a child of a foster parent. And the foster parent, when we asked them what they wanted, they said, we want to take care of our child at home. We don't want them in a congregate setting. So the wet blanket part of the testimony is that it seems to me in particular and others that to spend a lot of the state's resources on setting up childcare in congregate settings doesn't make a lot of sense, given the fact that the National Institutes of Health, the CDC, and our own Department of Health are discouraging congregate settings of any kind. Childcare and most childcare and all schools are closed, and they're closed for a reason. And it seems to me that the folks who are putting themselves at risk every day by going into the hospital and working there, or collecting our trash, or working at the grocery stores, for their kids are now at the most risk of any children in the system. And so that's really the message of my testimony. But one of the things I did want to get to is talking about parent-child centers in general and what their role is right now. Our Children's Integrated Services Program, before COVID, did 4,000 home visits a year. I mean, I'm sorry, 4,000 home visits a week, a month. I'm getting it wrong. Anyway,
A lot.
a lot of home visits.
Thank you.
So in the end, what we're doing is we're still doing those home visits. We're doing them virtually. We're doing them by phone. We're doing them by Zoom meeting. We're doing them by Microsoft meeting. We're doing them any way that we can that is HIPAA compliant. And what we found is that those home visitors who are really there to help parents work with their kids are really providing, they're the lifeline for some of these families. We're providing diapers, diaper wipes, grocery cards. We're delivering groceries. We're doing all the kind, all those lifeline kind of things that are not available to those families otherwise. We are finding that we aren't handing out as many gas cards as we have in the past, which I think is significant. But anyway, I think it's really important to talk about stabilizing other parts of the system as well as childcare. One of them is Children's Integrated Services, which I think is critical to the future of Vermont's young families, and parent-child centers in general. There were parent-child centers, we fortunately are not one of them, but there were parent-child centers who were really struggling prior to COVID, who are now providing vital services to their families, and yet they are still struggling financially and just barely making payroll. So it's important to note that. And boy, I wish I could go surfing right now. That really. Anyway, I think it's important to say that congregate care doesn't make sense. It doesn't. And I think that it's important to have somebody say that out loud. Because, if we were to spend state resources working with child care providers to provide care in people's homes, that's a different matter. But it doesn't seem like a lot of that is taking place. So that's my wet blanket, and I apologize for being that guy.
So thank you for that. I actually had a very informative email from the Burlington Children's Space, where they've tried a new model that includes a one-on-one model that they feel is working exceptionally well. And I've asked Nellie Marvel, our committee assistant, to put that information up on our webpage so we can look at it, and it might be helpful. I think analyzing the expense of something like a one-on-one model might become cost prohibitive, but utilizing volunteers and then ensuring that there continues to be social isolation and prevention in place. It's a huge challenge. But thank you for your comments on that. As depressing as it sounds, they are important comments.
Thank you, Madam Chair. And listen, I think we are in great hands. I thank you for keeping the wheels on the legislative process. Thanks to Allie and Stephen and Melissa for the work that they're doing with all of our child care providers. I feel like Vermonters are in great hands, and a lot of the credit goes to you folks, to the administration for the way you're responding to this. So thank you.
All right. Well, thank you, Floyd. And we haven't forgotten parent-child centers. They are critical. We understand that.
Thank you,
Morgan, you're back.
I am sorry about that technical difficulty. This is Morgan Crossman, Executive Director at Building Bright Futures, for the record. I am going to leave my video off just because of the unstable internet connection in this moment.
Okay.
So to go back to the 3 key charges of building bright futures under Act 104, one of the primary components of our work is to serve as a neutral convener. And we are seeing this as so critical in this crisis to be convening Vermont's early childhood community and fostering coordination and collaboration on behalf of Vermont's children and families at every level. We also are charged with monitoring the system of services and child and family well-being. So we've developed a mechanism to consistently on a daily basis track the questions, comments, concerns, and barriers and gaps that are happening on the ground for kids and elevating those to our agency partners and other decision makers. And the third component is advising the governor, the administration, and the legislature on the current status of children and families. And the way that Building Bright Futures does this work is having a 3-tiered structure. So we have at the base of this structure, 12 regional councils that serve as our regional network that identify gaps and share best practices at the local level. They take action to improve systems and services for young children and support integration on the ground. We also have a 23 governor appointed body called the State Advisory Council, where we bring together early childhood leaders and decision makers across sectors for systems level discussions on how to coordinate and enhance the system for young children. And then we also hold the early childhood framework and the vision for early childhood for the state of Vermont. And we do that by supporting and implementing Vermont's Early Childhood Action Plan, otherwise known as the ECAP. And so I do want to transition now to talking about how we have used this infrastructure to support the community and the state in the COVID response. So our team has immediately pivoted alongside our partners to virtually now convene meetings at the regional and statewide levels to address emergency childhood response as well as strategy. We hosted our first all virtual State Advisory Council meeting earlier last month, and that was attended by more than 65 early childhood leaders. And I think it's important to know that as we've been collecting information from folks on the ground, I'm not going to be able to present every single question and comment to the committee today, but here are some of the themes and priorities that have started to emerge statewide. The first, and not surprisingly, is childcare, right? So we're hearing the need for emergency childcare for essential workers, and then guidance, clear and concise guidance to the field. We're also hearing about challenges with food security and basic needs in the form of diapers, wipes, formula, growing resilience on food shelves, and the use of WIC. And all of those are also very relevant to this childcare discussion today. We're also hearing a ton about parent and caregiver safety and mental health, as well as risks for abuse and substance abuse. We're hearing quite a bit about health and health insurance. Again, very much so when we're hearing about the need for essential employees having health care. And then another thing that hasn't really been discussed is lack of connectivity for families. So the fact that families are in some cases rural, don't have access to phones and computers. And then a ton of information and questions about sustained closures and how we best support childcare providers, educators, children, and families in distance educating. So the role of BBF specific to the childcare response has largely been in our area of neutral convening. So we have supported the broader system to stand up the web form to support emergency childcare for essential persons in partnership with Let's Grow Kids and the Child Development Division. We have also played a role in not only gathering information, but helping disseminate information through all of our different infrastructure levels to support the dissemination of CDD guidance and frequently asked questions. As I mentioned before, we've been monitoring and documenting questions, comments, gaps, and strategies that are emerging in the field, and then on a weekly basis, elevating those to our agency partners to help inform guidance documents and frequently asked questions. And not surprisingly, there has been a multitude of questions around childcare from parents, providers, educators, and the field, given the fact that we are seeing such evolution in the guidance over the last few weeks. We've also partnered with the Child Development Division and Let's Grow Kids to quickly respond to questions from the field by developing a new series of early childhood forums. So starting this Friday, we will have a series of early childhood forums focused on childcare, where we are providing a direct opportunity for folks in the field to hear directly from agency partners and be able to have a consistent.
We lost you. Morgan, we've lost you. We're waiting a few minutes. We've lost you.
Okay,
Okay, you're back.
fantastic. Apologies again.
No, don't apologize. It's technology at its very best.
So I am not sure where I left you, but we stood up a new early childhood forums
You're
series.
having a webinar. You were having a webinar. Yep. And you told us about that a little bit.
Perfect.
Yep.
We also have bi-weekly meetings with the Child Development Division, Let's Grow Kids, and Vermont After School to be troubleshooting and having conversations about how we align and how we get information back out to the field. And so now I want to transition to what BBF is hearing from the field on successes and persistent challenges in the childcare arena. So again, I think that one of the key roles that BBF is able to play right now is to be able to elevate the messages that we're hearing from our key stakeholders on the ground. So in terms of the successes, we have absolutely heard that Vermont has mobilized quickly to respond to the needs of children and families, especially in the emergency childcare arena for essential persons. We also have been really excited to hear that they're utilizing existing partners and the existing as they've stood up this new process in a very short period of time. Another important thing to point out is that there has been really incredible cross-agency, cross-sector, and public-private partnerships that are emerging. So some that hadn't been there before and others that have been strengthened in this period, primarily between the Vermont Department of Health, childcare and the Child Development Division, Let's Grow Kids, the K-12 food system in thinking about how we best provide care and access to meals. And the fact that each family who is needing care is being discussed across partners to ensure the best and safest delivery of care during this crisis. We also know, and this has been discussed at length on this call, that there is regular and consistent communication to the field, although we still need some clarity. And there's been recognition of the importance of childcare as essential to our state and to our economy. We've also heard successes in collective impact. So even outside of BBF's general structures, we've heard that there are weekly emerging forums within regions that are reviewing and discussing guidance and developing collective questions to send back up the chain to decision makers. And then on the other side of that, we are hearing about some of the challenges that are remaining in the childcare arena. And these won't be a surprise to anyone on the call, but I do want to make sure that I outline these. So one is financial.
We lost you. You're gone. You're gone. We're waiting. Morgan? Morgan? Just got to the good part of your testimony and we lost you. It's all good. That was a joke.
Can everyone hear me now?
Yes, you got right to, you said finance and then you ended.
Beautiful. Okay.
Okay.
So in terms of financial concerns, we have heard from programs that there is still concern about the ability to make payroll. There's still some persistent confusion on how to bill and submit invoices. And there's question around funding streams applied to families. So we talked a little bit earlier about the Child Care Financial Assistance Program and also pre-K dollars. The second area in terms of challenges that we're hearing is the perception of interagency partnership. So there's a perceived notion in the field that there is still a lack of coordination between the Agency of Human Services and the Agency of Education, which folks are essentially trying to determine who to go to identify the most up-to-date information. And I think that over the last week that has been clarified and that all matters of child care are going through.
We lost you. Oh, you're there. You're there.
Okay.
Everything's going through AHS is what we heard you say.
Perfect, thank
Yeah.
you. So I think that there has been some clarity there. We're also hearing some concerns from families, and I think this has been discussed. So in terms of enrollment, there is concern that families may be losing their space if they don't have the ability to meet that 50% requirement. In that same line, we've also heard that providers and programs are really mindful of the needs of families and are really doing their best to adapt in this moment to meet the needs of families. We've also heard a need for alternative models of care. And I think folks have heard Floyd talk a little bit about this, and also this idea of a family, friends, and neighborhood network, which I'm sure others can speak a little bit more about if necessary. Another area that we've heard challenges is in the area of health and safety for teachers and staff in centers and homes. And again, I think that the state has been really phenomenal in partnering the Child Development Division and the Vermont Department of Health to create these joint guidance and webinars to support some of those concerns. And then the final concern that we've heard from the field is on clear and consistent communication. So again, I think that Senator McCormick addressed this earlier, that there's so much information that's coming out to the field. It's coming through really quickly, and just a plea.
We lost you. We lost you again. Morgan, we're waiting. You're still not back.
How are we doing?
Now you're back.
Thank you.
Okay.
Just a firm request from the field for even more clarity, and that all guidance and FAQs are written in an accessible way. So again, I think I just want to end by saying I really appreciate the time today, and I'm happy to serve as a resource to this committee in elevating concerns and successes from the community. And I'm so grateful for the partnership of the agencies as well as our communities in being responsive to the needs of children and families right now.
Thank you for that. I think that we're going to hold questions until we've heard from Tricia Coates. But I do want to say that your request for clear and consistent guidelines that are accessible is something that we've heard from other folks. I mean, everyone from people who are working in the grocery store to people who are working in other in various care facilities. So as things change, it becomes more and more important to have those written, accessible, consistent, clear guidelines available for everyone. We're working on that with the Department of Health. I know that the Pro Tem has sent a request out trying to get a response for our grocery store folks. But I see this as really very critical. So anything that Steve, you can do to help us with that one for childcare, you've heard the concern, that would be helpful.
Absolutely. And certainly these concerns aren't new to us. We talk with our friends at BBF and other community stakeholders regularly.
Thank you.
Glad to say that we have a revised FAQ going out to providers, which consolidates a lot of the available information in a much more accessible manner. And also we have a document that's almost ready to go out to families to help them understand better what an essential person is.
Excellent. That's excellent. Anytime that you want to share that with this committee would be welcome. I know we get overload, but having that is very important, because we hear from constituents all the time, and we can help disseminate that information as needed.
Of course. Thank you for the offer.
All right. Morgan, thank you very much for your testimony. And if you don't mind taking some time when you get a minute, I know there are no minutes in our lives right now, but it would be very helpful to have your challenges and recommendations in written testimony that we can put on our webpage.
Absolutely. I'm happy to do that. Thank you for having me today.
Thank you. So Tricia, we'll move to you and then we'll open it up for some more questions. Thank you
Very
for
much,
being here.
Senator. It's so great to see all of your faces.
Well, it's
And I
good to
look
see
like,
you.
thank you. I look like I'm in an old movie here. So thank you for your time. Thank you for your ongoing support for the work of frontline childcare, family services, mental health, substance use disorder treatment providers during this pandemic. Lund is pleased to have been able to reopen our early childhood program for the children of essential workers. Of the 50 families that we typically serve, 9 were identified as children of essential workers, and half of our teachers were eligible and not in any high-risk category in terms of coming and working with families. On the 30th of March, we reopened with one child, and over the course of that week, we picked up 5 additional children. We have 2 teachers providing this care, and if our student numbers go up to 7, we will add another teacher. Every day, families, children, and teachers are pre-screened before they enter the center. And we take everyone's temperatures and check for symptoms. We use one of our classrooms and one bathroom just so that we can contain any possible exposure. Parents are bringing prepared lunches so we don't have to use our kitchen at all. So we're just following the guidance and doing the best we can to serve these families. Thorough cleaning and janitorial services for overnight deeper cleaning. Half of our private pay families have been able to continue to hold on to their slots with the 50% payment of their tuition, and the remainder unfortunately had to unenroll because they could not cover the cost. And then finally, we continue to explore with a desire to open up another room and serve additional families who were not previously enrolled in the Lund program. We understand there's a high demand, especially for toddler and infant care for essential workers in Chittenden County. So we are looking how we could prioritize this need. As is reflected in a lot of the testimony this morning, Lund's early childhood program is central to the range of services we provide to our clients. And we share the concern about the future of this business, the childcare business. But in the meantime, your support for this emergency reopening and for continued funding has really given us the opportunity to plan for the future. So thank you for that. And if I could just take one more minute to go a little off track. You know, Lund doesn't fit neatly into the category of solely a child care provider, a designated agency, or a long-term care facility. We provide direct services to families across the state in partnership with the Departments of Children and Family Services, Corrections, ADAP, and we touch 5,000 Vermonters annually. At this time, most of our services have transitioned to virtual platforms, and our staff have worked diligently to maintain connections with families who are truly under tremendous stress right now. Our parent-child center services continue with ongoing education and support for families of incarcerated women and families at risk for substance use and mental health disorders. Our Project Family Adoption services continue, and this has been our inspiration, with 20 adoptions for children in foster care finalized in March alone.
Wow.
Our most intense COVID-19 response planning has focused on keeping clients and staff safe and healthy in our residential treatment program, which serves 26 mothers and 28 children in the same building. And at Independence Place, our transitional housing program that is winding down but serves 6 families still. So with significant protocols in place, no clients and staff have tested positive. Knocking on wood. We are prepared with 2 offsite recovery locations if we need them. So I'm just so impressed with the determination of our staff to stay connected with these families. Expenses related to COVID-19 response, our altered service delivery, and impact on development are sure to have lasting effects on Lund's finances for the foreseeable future. Ongoing reimbursement and flexibility from state agencies has been critical, as will the assistance from the Federal Paycheck Protection Act. Thank you for remembering Lund and our staff and clients during this crisis.
Thank you. That was very helpful and comprehensive. Thank you for your good work and good luck on the no
Yes.
infection rate. That's impressive at this point.
Yeah.
Questions for Tricia or Morgan from the committee? This has been very, I do have one question. I ask it at the risk of opening up a large discussion, but just the question I have really relates to something I think Floyd or I forget who mentioned it, I apologize, but children's integrated services and how those needs are being met. You know, think of the kids on the autism spectrum or other areas who are needing services, and whether we answer this question fully right now, just to know that it is an important question. And Floyd, I see you turned your light on. You came in from surfing, and if you could, I think you're the one who wanted to answer this question. Could you do that briefly?
Yeah, and by the way, the number is 4,000 home visits a month. So
Thank
just
you.
to be clear.
Okay.
And so what's happening is EI is the most challenging because doing an assessment virtually with some children is virtually impossible. But we're trying to do our best. Our early intervention folks are, you know, we're anyone with a telephone. We've even, you know, some CIS programs have provided flip phones for people just so we could have conversations with them. So they're getting supports, they're getting parenting supports. We're continuing to provide parent education virtually, and play groups are happening because we have people reading stories, some at set times, some just reading a story and setting it up on YouTube to be played by the parent at their convenience. So there are all kinds of changes that have taken place. But to your point, those parents need to talk. They need to talk to somebody about the challenges that they're having. And if you have a child who requires special education services that can't get them right now, you know, you need some coaching, and that's the kind of work we're doing.
Okay, thank you. I think we may at some point follow up on with the CIS question. I know it's out there, and we have heard testimony jointly with education regarding some of the special ed needs, and this sort of falls into that spectrum. So,
Madam Chair, just so you know, we have a memo. Stephen hasn't opened his email, so he probably doesn't know this yet, but a memo has been sent by a bunch of CIS providers to Stephen and Ken and Morgan Cole. And we'd be happy to forward that to you if you'd like.
that would be terrific. And please copy Nellie so we can put that up. It'll help us all read it and understand where things are and the requests that you're making of the administration. And I just, Steve, if we can help, let us know, because I think this has been a heavy lift by everybody, and it's going to continue.
Thank you, ma'am.
All right, good. Thank you, Floyd, for that. And any further questions for our guests, for Tricia or Floyd or Morgan or Melissa or Allie, Steve?
They were all very clear, and really appreciate hearing about all the great work that's going on.
Very much. There's more to do. We know that. Senator Cummings, you're muted. You're muted.
Unmute, I'm here.
Okay.
I just want to put in my pitch again for it's not just parents with kids with special ed or, special needs. All parents need somebody to talk to right now when they're shut home. And, the faster we can get just some kind of a chat line or something set up. So, I mean, some of these parents, their kids have been in childcare almost since the day they were born, and suddenly you're shut at home with a toddler and a newborn, and life is very different. And I think, everybody needs that kind of support. Did Ally have?
Ally has her hand up.
I just wanted to respond. Thank you for that. It's such a good point. And as you saw Melissa and Morgan, and I neglected to mention I've got my two 16-month-old twins running around here, and they had been in childcare a couple days a week. So definitely, it's a point well taken, and I like your broader idea. But I neglected to sort of mention one thing that was my testimony, which was early educators, because of this program, they're on payroll in many cases. They are working. And a lot of my staff have benefited from this. You're making such a good point about they're helping, especially for the little bit old, like the 3-year-old kids, perfect, scenario. They're doing circle time, story time, they're connecting them with other kids, but they're also really supporting the families right now. And so one thing that we're able to finally turn our attention to a tiny bit is supporting early educators in supporting their kids and families in this way. Some are modeling it beautifully. There's some best practices right now of how to connect, but you're right. They're supporting parents through behavioral issues, setting them up with a routine at home, and just, tips and tricks, to get through this tough time for everybody's mental health, but also for, the support of these children and their development. So, I appreciate the point, and thank you for letting me interject that one piece, which I did neglect to mention earlier. It's a big role that is being played right now.
Thank you for that. Yeah, this is a very key area, and maybe it is a next step we're hearing. It's an important next step. Some places are doing some of these things, but others need help. So we need some consistency for families.
Yeah. If we could open up story time.
Yeah. Morgan, I think you had a comment you wanted to make.
Yes. Thank you, Senator Lyons. And thank you, Senator Cummings. I also want to mention that at Building Bright Futures, we have a Families and Communities Committee that has been open to the public for quite some time, but we have now started disseminating that information much more broadly. And it is a space where families can virtually come together, not necessarily to have the children be interacting, but to have the parents have space to connect, identify challenges, and identify the different ways. So we are strategizing with as many community partners and families as we can, in addition to our agency partners right now.
Thank you. Floyd, you had a comment.
Yeah, very briefly, to Senator Cummings' point, we're doing the virtual story hours, we're doing virtual circles, we're doing any way we can get those parents some support. We provide it, because it really is hard. There are teachers who are at home trying to provide care for toddlers, multiple toddlers, while teaching their classes back, virtually, and it's incredibly challenging for them. And we're providing some support for some of them as well.
We kind of need Sesame Street all day. All right. Thank you all. Committee, any other comments or questions? Senator Cummings, good question, good comment. Anything else?
Everybody is on an equal playing field.
Senator McCormick.
Thanks. Just for people who are having difficulty with the technology, I just want you to say how much I envy you that being young people, it's presumed the technology wasn't working. When it's an old man, the assumption is that I'm screwing up. So
Not true, Senator. Not true. Okay. So thank you all for being here. I think we're going to move into some committee discussion for just a few minutes. We have about 10 minutes left, and I want to share some things with the committee. You're welcome to stay on and listen, but it's not anything that is related, I think, to to the childcare issue at this point. I'm going to place childcare discussion up for another time. So thank you for being here. Take care and good surfing.
Thank you. For having
So committee, tomorrow we've run into a little glitch with our schedule. The Senate is on the floor at 9:30. So I'm going to be working with Nellie to try and figure out if we can push our testimony out. The testimony that we're having from Mike Smith and Vicki Lohner is actually pretty critical right now. There's some changes going on, not just with the federal legislation, not just the communication of what's happened in H742, but some other things that I'm concerned about relative to payment reform and what the Green Mountain Care Board is deciding to do with our all-payer waiver. So we will try to have some testimony tomorrow. We'll meet as much as we can right after we're off the floor. We've heard from the pro tem that floor will not last long, but I don't know what that means when we've got 3 bills. So we're going to play it by ear. Okay, Senator Westman.
Just to throw it out there in this, I'm willing to meet through lunch.
Oh, good. Okay, is everyone else willing to do that?
Well, actually, tomorrow is Good Friday, and I was kind of
Oh, sorry.
an online service, but
okay. All right,
yeah,
we'll
but,
play it by ear, and we will not intrude on that, Senator. Thank you for I should.
Sorry,
It's all Senator Westman's fault. No.
Yeah, it's all my fault. Sorry.
Most days I'd be happy to, but just. Yeah.
Okay, no, that's fine. We'll see what we can do. Just keep your eyes and ears open for an email, probably, maybe a text, but email probably. I did want to say that I know that Senator McCormick has an interest in the foster care issue, and I want to make some time to talk about that. If we have some time tomorrow, we'll put that on as a discussion item. Senator Ingram has a discussion item that she's very interested in on diversity and the COVID response. And I have a discussion item on a piece of legislation related to access to prescription drugs that I'd like to talk about. So we're going to try and put 15 minutes up for that. So that will be tomorrow, or if we can't do it tomorrow, we're going to do it first thing Tuesday. That's just the way our lives are right now. Everything gets shifted around at the last minute. So that's it. I'm going to go off and work with Nellie, and Faith is our backup support person, and Nolan is always our frontline support person, and figure out what our schedule might look like tomorrow, and I'll keep you posted. And you keep me posted. Thank you all.
Thank you.
Take care. Take care.
Ending the live stream now.
Leaving message. Thank you. Are we off?